What's going on, everybody? My name is Eli, and welcome back to my YouTube channel. Welcome back to the channel. Today I'm bringing you guys the second episode of my residency series. So if you haven't seen it yet, the first episode of the residency series started with Dr. Edmund Onwukwe, and I'll link the video up here. Edmund is an endodontic resident at Case Western Reserve University, and he shared a day in his life vlog style on my channel, and I decided I would do a series with all the residents and all the different residencies, just so that my subscribers could get an idea of what people do in their dental residencies, how it's different from dental school, various things like that. Just a realistic day in the life of a dental resident and all the different specialties. So today we have Dr. Christina Light. She is a first-year oral and maxillofacial surgery resident at the Oregon Health and Sciences University. Christina attended dental school at UCLA, and she is in a 6-year oral maxillofacial surgery residency, which means she is going to be obtaining her medical doctorate degree as well as a OMFS certificate. She does her own intro and explains everything else in more detail. But I just wanted to preface this by saying welcome back. This is the series that we have going, and this is who is doing the next episode. If you're new to the channel, my name is Eli. I'm a second-year dental student at Boston University Henry M. Goldman School of Dental Medicine. On this channel, I make dental school vlogs as well as videos with advice for pre-dents who are looking to get to the next level. So if that's something that interests you, or someone that you know, make sure you subscribe to the channel, share the channel with anyone who you think might find it interesting. And if you like this video, make sure you like the video and leave a comment under. That way I know that you guys are enjoying the series, that you guys are engaged with the videos, and that you're enjoying, everything that I put out. So otherwise, without further ado, let's get into this episode of the vlog. Dr. Christina Light, the oral and maxillofacial surgery resident.
Hi, my name is Dr. Christina Light. I am a PGY1 in the Oral and Maxillofacial Surgery program at Oregon Health and Sciences University here in Portland, Oregon. I got my DDS from UCLA in May, and yeah, so every program works a little differently, but here as a PGY1, I am an M3 student, so I'm in my third year of medical school. How it works here is you're with the first year med students for the first 10 weeks. You take and pass step 1 in order to move on to your M3 year. So I basically skipped the first 2 years of med school and I started doing clinical rotations. So this day was my last day on my first elective clinical rotation with wound and hyperbaric oxygen therapy. And then I had a 2-week intersession after that, which was mostly virtual. So just sitting in my apartment on Zoom. We did have an occasional in-person demonstration like this acupuncture. And they did chiropractic demonstration that day, but I didn't get that on camera. This is a 6-year dual degree program, meaning that I get my MD in the first 2 years, and in the last 4 years I spent getting my oral and maxillofacial surgery certificate. I also do a year of gen surg during that time. So when deciding between 4 and 6 year programs, it is such a personal decision. There's so many things to take into consideration. There's no real checklist of this is why I should choose a dual degree, this is why I should choose a single degree. I think ultimately you can do what you want after both of them. But for me, I kind of knew that I wanted to do a dual degree program. Even though I applied to both, the length of time is the biggest difference, and money. So normally you do have to pay for that second doctorate. You'll have to pay for 2 years of med school. I ranked this program first because it took away the financial burden. My medical school tuition is completely covered as long as I pass all of my classes, which is really nice. Another positive of this program is that I am allowed to moonlight if I choose. So I do work as a general dentist on the weekends, meaning that I get to put my first doctorate to use and practice my hand skills and make a little money too. Well, a typical clinical day for me does go from 8 to 5, sometimes longer, sometimes shorter. When I'm on a class schedule. Sometimes I don't have class at all. Like I'm actually on a pretty long break right now until my next clinical rotation. So I'll just do some fun things. I like to go to Blazers games in my free time, which is only 10 minutes away downtown. I like to play board games. I like to cook dinner and host my friends. And yeah, I just like to get out. There's a lot to do in nature in Portland. So there's a lot of close mountains to go hiking, to go skiing. The process to becoming an oral and maxillofacial surgeon is long and hard for sure, but I definitely think it's worth it. If you guys have any questions about the application process or what it's like to be a resident, not that I know a ton yet, things are definitely going to change for me over the next few years, and I'm excited to keep you guys updated. But please don't hesitate to reach out and let me know. You can hit me up on my socials or my email. Bye. Best of luck.
I mean, like, I wouldn't mind buying some new boots. Like, boots should fit well. So, I don't know.
So it's almost 8 a.m. and I just got to the hospital for my wound and hyperbaric oxygen medicine elective. So today is actually my last day of this 2-week rotation, and it's been super chill. And I'm just going to grab my morning chai.
Yeah, the patients have me do photo shoots with them. I have this one girl, she's actually a nurse here. She's a trapeze artist.
So it's about 4:30, which means I'm done for the day, heading home. Today, I got to do some debridements on some ulcers. Most of the patients have like diabetic foot ulcers or venous insufficiency that leads to ulcers over time, some type of like lymphedema. Yeah, so that's most of the patients who come to the wound care clinic, and then they qualify for hyperbaric oxygen therapy if they have non-healing wounds from things like cancer, excisions, or secondary effects due to radiation like cystitis. I think it's cystitis, things like that. So there's some relevancy with dentistry in that if patients have things like Imrange, they would be good candidates for hyperbaric oxygen therapy. And yeah, but all in all, this elective was not like a required course to take. It's just something that fit my schedule, and so yeah.
So as you guys can see from that vlog, since Dr. Christina is a resident in kind of like a hospital-based system, there are definitely there are usually patients involved in things like that, which makes it very hard to record her actual work and what she's actually doing. However, I'm very thankful that Dr. Light was able to share any type of her day with us, explain what her residency program is like, etc. Also, Dr. Light has her own YouTube channel that you guys can check out. I remember that I used to see some of her videos when I was a pre-dent, and that was actually what inspired me to reach out to her to see if she would like to do an OMFS vlog for the channel. So she has a YouTube channel that I'll link here, and also I encourage you, if you're interested in OMFS, to check out her video where she did, I think, like 10 things she wished she knew before applying, or a Q&A or something like that. But if you're interested in more information on OMFS, definitely check out the video that Dr. Light did on her channel. Make sure you subscribe and all that good stuff, as well as follow her on her other social media. Once again, thank you so much, Dr. Light, for doing this vlog for the channel. I appreciate it. I'm sure all the subscribers appreciate it, and everyone that's interested in OMFS. If you have any questions, please make sure to reach out to Dr. Light. Other than that, I'll see you all in the next video. Peace.